The surgeon's logbook, real medical torture practices. They said he was a genius. A man who knew the body so well he could cut without bleeding, dissect without killing, and open flesh like a locksmith unpicking the truth. But the surgeon never gave his real name. Just the doctor, written on the cracked spine of a leather-bound logbook, discovered decades later in the basement of a shuttered asylum. The pages were brittle, darkened with age and something far more organic. Each entry, written in a meticulous, looping script, began the same way. Subject prepared. Consent not required. For science. He believed medicine had lost its way. Pain, he wrote, was not something to be numbed. Pain was the signal of truth. And truth could only be uncovered if one dared to listen to the screams. The first patient was a vagrant, taken from the streets under the guise of charitable care. The doctor documented his condition clinically: male, mid-30s, strong musculature, heavy scarring from prior beatings. Then, in painstaking detail, he began. Incision made at the medial thigh. Fascia separated without anesthetic. Subject screamed until vocal cords ruptured. Fascinating. Laryngeal strain stronger than expected. Will attempt same on next subject with tracheal restraints to monitor airflow collapse. The entries only worsened. He created instruments no one had seen before. Forked scalpels, wire-threaded hooks, rib keys. He would drive copper spikes into the spinal column just to observe if the subject could still form coherent thoughts under a certain frequency of neurological interference. When one man managed to whisper the names of his children through clenched teeth, the doctor wrote only, "Remarkable fortitude. Children's names will be tested in next vocal response study." The asylum gave him space. It was, after all, the late 1800s, when institutions were less about healing and more about hiding. His wing was marked off. The nurses were told not to ask questions. And if a few inmates went missing here or there, well, the doctor always signed the transfer paperwork. One experiment focused on creating a controlled necrosis. He would bandage limbs too tightly, not to stop bleeding, but to kill them slowly. "The dead can still feel," he scrawled. One subject reported itching in fingers that had turned black. Fascinating. Another was more surgical in nature. He removed the eyelids of a patient who suffered night terrors, stating, "If one cannot blink, perhaps the brain will learn to sleep with truth exposed." But the patient didn't sleep. She screamed until her eyes cracked from dehydration. When the corneas clouded, he painted pupils over them in ink and called her the waking doll. He kept her near the surgical room, tied to a chair with velvet cords. No one knew if she was still alive. There were rituals to his madness. Every session began with a prayer to the body, not to heal, but to reveal. He believed the flesh was a prison of secrets, and only by forcing it open could the truth be extracted. In one experiment, he exposed the rib cage of a still-living man and affixed small brass mirrors around the cavity. The man could see his own lungs inflate. "He begged me to stop," the doctor wrote. "So I removed the tongue and asked again." Silence is compliance. One particular entry was longer than the others, splattered with blood and something like tears. Test 44, subject, female, age 19, diagnosed with hysteria. Prescribed surgical isolation. Administered perineal flaying to free the madness. No screams. No struggle. Only humming. She hummed the same lullaby for 37 minutes. Hypothesis: the melody is a dissociative anchor. Result: lullaby has been stuck in my head for 3 days. I cannot make it stop. His obsession with sound began after that. Not with speech, but with pain as language. He documented the pitch and duration of each scream, matching them to specific incisions and nerve points. He attempted to compose a symphony from them. The Pain Scale Sonata, he called it. In another wing of the asylum, he tried to conduct a patient choir, each voice activated by stimulus, a pinch, a burn, a slice. But they wouldn't harmonize. So he removed the vocal cords of the outliers. There were bodies in the walls. they found them when the asylum was finally condemned in 1932. One warden, curious about the drafts in the East Wing, pulled apart the plaster to find 4 corpses seated upright inside, each with the spine surgically altered into unnatural S-curves. Not broken. Reshaped. The logbook described it as Test 72, making the human violin. Strings of tendon, bridges of bone. Not yet playable. Refinement required. At some point, the doctor began testing on himself. He inserted tubing through his abdomen to reroute digestion for observational purposes. He drilled small holes into his skull to measure intracranial pressure during emotional trauma. And when he could no longer find enough pain in others, he used mirrors to replicate it on himself. The last entries are unsteady. Scrawled. Mad. The body lies. But the marrow speaks truth. I felt her singing through the veins. Not the girl. The idea of her. Hysteria is not madness, it is memory. Every nerve is a locked door. I have so many keys. Then, silence. The logbook ends with a drawing. It's not medical. It's a crude sketch of a figure, faceless, arms open, body flayed into petals. Beneath it, one sentence, I am blooming. When they finally cleared the asylum, they found the doctor's operating theater sealed with welded iron. Inside, the floor was sticky with decades of rot, the lights still intact, though the bulbs had long since blackened. And in the center, an empty chair, with wrist and ankle straps snapped. Blood on the ceiling. No body. Only the logbook. Wrapped in a woman's shawl. Since then, those who've read it, really read it, have claimed they start to hear things. Not voices. Not whispers. But the sounds of metal on bone. Screams at odd frequencies. And worst of all, music. Faint. Distant. Like something ancient trying to remember its own song. The logbook now rests in a sealed drawer at the medical archives of a university that refuses to name it. Once a year, a new student asks about it. And once a year, someone disappears into the basement, chasing the truth. And sometimes, late at night, a scream is heard echoing through the pipes. Not a scream of pain, but of discovery. One winter, a janitor named Elias was called in to repair a leak in the sub-basement of the university. He wasn't a student, not a professor, just a quiet man with a limp and a habit of humming to himself. The call sheet said corroded piping, but when Elias descended past the first set of storage rooms and down into the old brick tunnels, the air changed. He said later the pipes weren't leaking water. They were wet with something thicker. And colder. He followed the source, flashlight trembling in his grip, until he reached a locked archive room with a rusted placard that had no name, only a number, Unit 9. Inside, he swore he saw the logbook. Not on a shelf, but open on the floor, pages turning in a breeze that wasn't there. The flashlight flickered. And for a split second, he saw the chair. The one from the sketches. The one with the leather straps. Only it wasn't empty anymore. He quit the next day, left without collecting his final paycheck. He told no one except the night librarian, who found him on the steps of the chapel shaking, whispering, "He's still cutting." He never stopped. You just can't see it with your eyes. Because the book wasn't paper. Not entirely. One girl claimed she touched it. Her roommate said she came back to the dorm with bandages around her fingers. Said she'd been cut just from turning the page. That her fingers bled ink for 3 days. Another said she found a photocopy of one page slipped under her dorm door. The paper was cold and wet, and when she tried to throw it away, it reappeared the next morning, folded into her anatomy textbook. That same week, she dropped out and flew back to Romania. No explanation. She left a single note behind. I heard him humming in my sleep. I think he's working on a new piece. No one talks about the experiments openly now. Not in class. Not in labs. But some residents say, if you walk past the west wing of the old medical library around 3:33 a.m., you'll hear something faint. A scraping. Like metal being dragged across tile. Or maybe bone. And if you listen too long, you'll hear the music. No instruments. Just voices. Wailing. Crying. Held in perfect dissonant harmony. The university denies all of it, of course. But the rumors persist. Especially after the incident last spring. A student named Amara, top of her surgical class, went missing for 3 days. When she was found, she was wandering the fields behind the campus with no shoes, no coat, her palms flayed open in perfect spirals. She wouldn't speak, wouldn't respond, but they found something tucked into her coat lining. A page. Handwritten. The same curling script. Same brown red ink. Subject prepared. Consent not required. For science. She was institutionalized. Her parents sealed her records. But a nurse who worked in the psychiatric ward claimed Amara had carved something into the wall with her teeth. Letters. A name. Not hers. The doctor. And then there's the thing no one dares to mention. Sometimes, when cadavers are wheeled into the dissection lab, students find things that aren't supposed to be there. Small brass mirrors stitched into the lining of the chest cavity. Ink painted across the pupils. Rib cages reshaped, not broken, but bent into unnatural curves. No record of where these bodies come from. The paperwork is clean. But the truth lies deeper. Some say the doctor isn't a man anymore. That he's an idea, passed through the scalpel. That every student who reads the logbook, truly reads it, leaves something of themselves behind. A sliver of sanity. A memory. A whisper. And in return, they gain something too. A little more precision with their cuts. A little more indifference to the screams. And maybe, just maybe, a song they hum when alone in the lab. A song they don't remember learning. A student once asked their professor why one of the preserved skulls in the anatomy room had been drilled perfectly in the center. The professor said, "That one? We don't know. It was already here when the university was built." They didn't tell the student that the skull was warm to the touch. That no matter how often it was cleaned, blood kept appearing behind the teeth. Not human blood. Something thicker. With ink in it. The university no longer allows tours of the archives. The basement tunnels have been sealed. But when storms come and the electricity flickers, some students swear they hear the lights buzzing in a rhythm. Not random. Not broken. Measured. Like a heartbeat. Like a metronome. Like the surgeon's logbook is opening again. And he's ready for another entry. It was supposed to be a myth. An urban legend, passed down between trembling med students and whispered in dark libraries after midnight exams. But then came the case of Dr. Lysander Shaw. He was the youngest attending surgeon the university ever produced, brilliant, ambitious, and cold. His hands were flawless in the oar. He once performed a 12-hour reconstructive surgery without a break, barely blinking. Some called it genius. Others whispered he'd been changed by something. Because Lysander had gone into the archives. He petitioned for access. Wrote a paper on forgotten surgical tools. Requested a solitary key to Unit 9, citing academic integrity. The administration denied him. Yet 2 weeks later, someone broke into the sub-basement through a maintenance shaft. They found the door to Unit 9 open. The lights on. And nothing missing. Except the logbook. Dr. Shaw changed after that. He started speaking in metaphors no one understood. He told residents that pain was the clearest voice in the human body and that we have been trained too long to muffle it. He canceled anesthesia from minor procedures, citing neurological mapping. He wrote a paper on voluntary vivisection, claiming it could unlock emotional trauma buried in tissues. When it was rejected for ethical concerns, he withdrew from the faculty. But not from his work. The reports began soon after. A patient from the psych ward claimed that Shaw had visited him in the night and asked to see inside his sadness. The man was found in the morning with his chest open from sternum to navel, yet no blood trail. No sign of restraint. Just a word carved delicately into the liver, sing. He survived, barely, but never spoke again. When police searched Shaw's apartment, they found it abandoned. Clean. Too clean. The walls smelled of antiseptic. The fridge held nothing but surgical gloves soaking in saline. And in the freezer drawer, a heart. Still warm. No records showed where it had come from. But tucked beside it was a single page. Old. Brown. Edged in rusted blood. Test 128, the sound of a dying secret. Now people say Shaw didn't steal the logbook. He woke it. They say it's no longer a book at all. It's a thing. A patient. A recording. A parasite. A growing archive of agony and precision that demands new material, new procedures, new truths carved into living tissue. And it doesn't just sit on shelves anymore. It finds people. Students claim their surgical notes rearranged themselves overnight. Drawings of hands and organs appearing where their textbooks had been blank. One girl opened her locker to find her notebook soaked in something sticky, and all her diagrams redrawn in perfect anatomical detail, labeled in the doctor's looping script. She transferred the next day. She said she dreamed of a voice behind her own eyes. Subject prepared. Some believe the logbook rewrites reality. That when someone reads it, truly opens themselves to its knowledge, it plants something in them. A new sense of touch. An instinct for what lies beneath the skin. A desire. A compulsion. A need to know how things work, by opening them. A professor, once skeptical, confessed during his final lecture that he no longer remembered the faces of his first patients. Only the shape of their pain. Then he pulled out a scalpel and slit his own stomach across the podium. Before collapsing, he whispered, "It's not about the body. It's about the song." And in the silence that followed, some students heard something. A hum. Faint. Familiar. No one found the scalpel afterward. Only his hands, detached, perfectly severed, resting palms up on the lecture table. The investigation found no motive. No signs of mental illness. But on the security footage, the professor can be seen standing in the empty lecture hall the night before, speaking to something not visible on camera. Holding a page that kept flickering in and out of frame, as if reality couldn't decide if it existed. The footage ends with him looking into the lens, smiling faintly, and saying, "The next entry begins tomorrow. The subject is you." Since then, rumors of the logbook have spread far beyond the university. Some say it has been digitized. That copies exist in hidden folders on medical servers. That it can download itself into PDF format if you search the right terms. But if you open the file, strange things happen. The cursor won't move the same. Your own anatomy diagrams begin to shift. Your eyes hurt, not from strain, but from something inside them pulling toward the screen. A few weeks ago, a top surgical student live-streamed himself performing an unauthorized operation on his own thigh, no anesthesia. He spoke calmly, narrating the anatomy in precise detail, occasionally humming. Before the feed cut out, he whispered, "For science. Consent not required." They say he's missing. But some of his classmates still get voicemails from his number. No words. Just the sound of surgical tools clinking on a steel tray. And breathing. Heavy. Slow. Right beside the microphone. There's no safe distance anymore. You don't have to read the logbook to be part of it. You just have to know about it. And now you do. It may already be writing your chapter. There was a second logbook. That was the whisper shared between pathologists over drinks, between exhausted nurses on smoke breaks. A second volume, not a continuation, but a mirror. Not written by the doctor, but by those he touched. They said it surfaced in an abandoned medical tent after a flood in Bosnia. The field hospital had been abandoned for years. When aid workers arrived, They found surgical tables bolted to the ground, scalpels rusted into the floor, and something waiting in the corner. Wrapped in gauze. Swollen with rot, yet unmistakably deliberate in its preservation. Inside the gauze, a book. Bound in human skin. Or what looked like it. And inside, hundreds of entries. Each beginning differently, yet bound by the same broken rhythm. "I didn't mean to see," it whispered while I cut. "I only wanted to help her." He stood behind me. He's still behind me. These were not the doctor's writings. These were the testimonies of those he'd infected. A nurse who stitched a child shut from the inside. A medical student who extracted her own uterus just to understand birth backward. An army medic who learned to hum the frequency that stops hearts without touching them. A mortician who practiced surgeries on himself so he'd never forget the shapes of the living. Each entry more chaotic than the last, as if language itself began to decay under the weight of what they had seen. The final entry was not written in words. It was a drawing. A face, or what might once have been one. The features peeled back in layers. Eyelids like petals. Teeth arranged like piano keys. A tongue spliced into ribbons. Beneath it, a sentence carved through the page, bleeding into the cover behind it. Pain remembers what history forgets. And now, both books are gone. Or rather, scattered. One believed to be somewhere in the basement of the university, still writing itself, entry by entry, long after the doctor's hands rotted away. The other, appearing in parts. A page mailed to a forensic analyst in Madrid. A torn fragment found under the fingernail of a med student in Ontario. A full chapter posted anonymously on a private forum for surgical residents, only visible between 3 o'clock and 3:04 a.m., then vanishing without trace. The infection is no longer confined to operating rooms. It's leaking. Through screens. Through case studies. Through dreams. There's a rise in unexplained medical phenomena. Patients flayed without instruments. Bones reshaped as if persuaded rather than broken. Scar patterns that mimic musical notation. One man woke up from anesthesia with a single sentence carved into his femur, not a wound, not a surgery mark, a carving, from the inside. He's tuning us. And it's not just those in medicine anymore. A mother in Germany sliced her child open after claiming she heard a heartbeat in the liver that didn't match his own. A street magician in New York made a woman's intestines appear from her mouth during a trick, and couldn't put them back. A prisoner in Seoul managed to remove his own lungs without dying, writing in blood across the wall, "You cannot hold your breath forever." The surgeon's logbook was never about science. It was a ritual. A gospel written in wounds. And now, it is being continued. By those who seek its knowledge. By those who don't know they're writing in it. By those who think they're resisting it, and are, in truth, already subjects. The next version won't be bound in leather. It will be digital. It will be oral. It will be biological. It won't require reading. Only remembering. So if you wake up tomorrow with a pain that wasn't there before, an ache beneath the ribs, a pulse behind the eye, a cold spreading through your hands like surgical gloves, understand this. You are being prepared. You are being documented. And one night, while looking in the mirror, you may see someone behind you, not a person, but a shape made of observation. Watching. Waiting. Scalpel in hand. Ready to write. The night shift nurse who first noticed the changes never meant to get involved. Her name was Rosa, a quiet woman who kept to herself and worked at St. Augustine's Infirmary, a crumbling hospital in a city no longer on most maps. It was the kind of place that still used paper charts and kept its x-rays in folders older than the staff. It began with patient 74. He came in with no ID, no clothes, just a note stapled to his thigh. A real steel staple driven into muscle. The note said, "Do not sedate. He's listening." They tried to remove the staple, but the man seized violently, as if his nerves were wired to the paper. He screamed in a voice that wasn't human, not in tone, but in structure. Like chords, like overlapping frequencies. Rosa said it made her teeth ache. Her vision blurred for hours afterward. The surgeons went ahead anyway. They sedated him. Within 48 hours, 2 nurses were dead. One found upside down in the janitor's closet, spinal cord pulled out like thread from a bobbin. The other simply missing, her uniform folded on the surgical table, still warm. Rosa began to hear whispers in the morgue freezer. Not voices. Just pages turning. And that's when she found the mark. Not on the patient. On herself. 3 perfect dots burned into the skin just under her clavicle, forming a triangle. She didn't remember how they got there. They didn't hurt. But sometimes, if she pressed on them, her vision would sharpen, and she could see beneath people. Not metaphorically. Literally. She saw tendon. Muscle. Vibrations within organs that pulsed to different frequencies. She saw faults in the flesh, things that weren't meant to be there. A patient with cancer whose tumor blinked when it thought no one was watching. A stroke victim whose blood vessels whispered "I remember" when probed with the ultrasound wand. And one night, Rosa dreamed of the doctor. Not as a man, but as a pair of hands, sleeveless, skinless, endless, arranging the world like a dissection table. Every river was a vein. Every forest a patch of hair. Every church spire, a vertebrae rising to pierce the sky. She woke with scalpel cuts on her thighs. That morning, she resigned. But she didn't leave. She stayed on the grounds. In the sub-basement. Volunteering to help with anatomical storage. No one questioned it. Until she stopped speaking. Until she stopped blinking. And then, she began writing. With no pen. She wrote by dragging her finger through blood, not always her own, across plastic sheets, stainless steel trays, even mirrors. Long looping cursive. The same script from the surgeon's logbook. One staff member tried to photograph the writings. His camera melted. Not exploded. Melted. The lens curled inward like burned flesh. The SD card became soft like cartilage. That's when the administration shut the basement down. Welded the doors. Reassigned Rosa's name as a clerical error. Her files were erased. She no longer existed in any employee records. But the basement lights still flicker. And sometimes, just before dawn, the elevator descends by itself, even though the button hasn't been pressed. One last incident is worth mentioning. A 7-year-old girl was brought in for abdominal pain. Her parents said she screamed every time she looked at her own reflection. During the ultrasound, Rosa, or the thing that was still wearing Rosa's face, placed a hand on the girl's stomach and said, "She's full of songs." The monitor flatlined. But the girl didn't die. She sat up, back arched, eyes rolled back, and began humming. The same tune mentioned in test 44. The lullaby that drove the doctor mad. She was transferred that night. The van that carried her never arrived. But weeks later, a music box was found on the edge of the hospital roof. Inside, a small, perfect replica of a human heart, carved from ivory. It played the lullaby. No mechanism. No winding key. Just music. And now, they say the logbook has spread beyond paper. It's in muscle memory. In the scars that appear on your skin without warning. In the rhythm of machines that stall, then continue as if remembering how to breathe. In hospital monitors that beep at 140 BPM, the tempo of a scream being swallowed. Medical schools are seeing a rise in students who don't blink when practicing incisions. Surgeons who hum when suturing. First years who cut too well, too confidently, and then claim they just knew where the pain was hiding. And patients are dreaming of hands, always hands, holding a pen that's also a blade. There is no surgeon anymore. Only his method. Only the continuation. You may already be part of it. That birthmark you thought was nothing? That itch beneath your ribs? That sound you hear in the silence, like a scalpel being unsheathed? Listen closely. Because the logbook never ends. It only waits for the next subject. And now, it's writing you. They found one last page, folded inside the chest cavity of a cadaver that shouldn't have had a heart. A final entry. Not typed. Not handwritten. Etched into the tissue itself, as if the muscle had grown around the words. No blood. No ink. Just perfect script, carved by something far too precise to be human. Final entry. Subject, the observer. Symptoms, curiosity, chills, a phantom ache in the fingertips. Diagnosis, infection by knowledge. Prognosis, terminal fascination. And beneath that, the scalpel does not choose. It only opens. They sealed the body. Burned it. Buried the ashes in 3 separate graves. But the words didn't stay dead. They reappeared in lecture slides. In CT scans. In the creases of folded gowns. Some students claim they saw them flash across a patient's eyes for just a second before anesthesia. Others say they heard them in whispered breath when they placed the stethoscope against a sleeping chest. The logbook is no longer a book. It is memory. It is ritual. It is the song between pain and understanding. And if you've read this far, if you've felt it stir beneath your skin, if you're still hearing the hum long after the words are gone, then you are no longer the reader. You are the next entry. Close your eyes. Do you feel that cold along your spine? It's the scalpel. It's always been there. And it has just begun to cut. End of log.